Good morning to you. Thank you so much for staying on the AM show. And like Benjamin mentioned, our next conversation is going to focus on the Akosombo Dam Spillage and its impact. And this time, we're not looking specifically to the floods alone, but the looming public health crisis. We know that officials have spoken about how we need to put immediate interventions in place, or else beyond the housing crisis, beyond displacement crisis, we're going to be dealing with a health crisis. This morning, I've been joined by Director of Public Health at the Accra Metropolitan Assembly, AMA, Florence Kuchi. I'm sure you're wondering what the AMA has to do with this, because this is happening in the Volta region. But Madame Kuchi belongs to the Graduate Environmental Health and Sanitation Professionals Association, and they've done a good job in paying a visit to the area. She's been interacting with her colleagues there, and she's also got first-hand information about what the situation there is. Good morning to you. Thank you so much for joining me this morning. You have visited the area, and we are sitting on a time bomb when it comes to a health crisis, right?
Sure. Yeah.
What did you observe?
So yesterday, myself and some association team members, we went to Sogakope to meet the Volta Regional Environmental Health Officer and her team members who are on the ground doing this tedious work on the ground to ensure that health promotion is gone deep down with the people. In fact, what we saw on the ground was very disheartening. Just around the Sopo, in front of the bridge, that place also got flooded. We went into a certain hospitality industry, and the whole place was taken off by water. All their septic tanks, everything was submerged by the water. And looking at the way those waters were looking, but the people still living around the area still goes there to fetch the water. In front of us, we have pictures and videos.
Wow.
We were standing there when the children, the adults were going in and out fetching the water.
What are they using?
So we tried to interview them what they were using the waters for. So they said they used to bath, they used to cook. So we asked them, so what do you drink? They said they drink sachet water. Don't you have pipe-borne water? So they said they ration the water every other 3 days. So water is life. So within the 3 days when there's no water, what do? We can't blame them. They need water to live. Yes. So they said they boil the water. Yes, after boiling, what next? This is the time we think as preventive practitioners. We need things like, let me say, aqua taps, chlorine tablets, so that we share among every household within all the affected areas. Not, some have not gone to the safe havens. They are still living within their places, because some feel that place is so crowded, we don't want to go, we still want. So this is the time we need to meet every household, distribute these items for them. Not only the aqua taps, they still need the filtration, the filters, yes, so that even after boiling the water, they can filter it for it to cool down. And some microorganisms at least will be dead before they drink the water.
Right. So they only boil the water.
Yes.
And they use it to bath and cook. Tell us the possible infections or possible health impact when they use these kinds of waters that have only been boiled.
So what we are having in our hands now is known as wash emergency.
Okay.
When we talk about wash emergency, we are talking about emergencies that comes out after a disaster. This is a disaster. Flood is a disaster. When there is flooding, diseases that can cause death most, according to WHO, in 2019, about 829,000 people died. And it was the cause of what? Poor wash facilities. Their water systems were altered with. Their toilet facilities were altered with. And what can they do? Water is life. They need to drink. They need to live. There's still use some of these contaminated waters, then diarrhea set in. Diarrhea is one of the serious cause of when there is such disasters. Then malnutrition is also another one. Because according to that research, 40% of the deaths were accounted for poor wash facilities and 80% for children under 2 years. And it was malnutrition. Children play, dirty hands, they come back. Even during such issues, mothers are so traumatized. So they don't even have time for what the child eats. Anything, the accounts will take pinting biadame. Yes. So I think these are some of the things. Diarrhea is looming. Cholera, let me say kudos to all the health promotion officers, especially environmental health officers, because that is our main mandate. We protect life, we promote health in the communities. They have tried their best. We are over 14 days now. We haven't yet recorded any cholera outbreak, and we are praying that we should not even record a cholera outbreak. But as for typhoid fever, there is no way we can do without it, because whatever it is, they are drinking the contaminated water, and this contaminated water are even mixed with fecal matters. And anybody who ingests fecal matter, the end results, if not diarrhea, cholera, typhoid is there. Yes.
Right. And you paint,
and even skin rashes are also there.
Right.
Yes.
Right. So you've assessed the situation. You've engaged with your colleagues who are there. Do you get a sense that we're on the right track to either mitigating or averting all these wash diseases you say are associated with disasters like we've seen?
Okay, so thank you. When it comes to the socio-economic aspect, we are on point.
Okay.
Yes, the socio-economic aspect, we are on point. But when it comes to the environmental aspect, there's still much to be done. As I said, the post-flood management is more important.
Right.
Because as and when the water settles, the place needs to be fumigated.
Okay.
Every day we are sending trucks full load of rice, oil, soap, mattresses, canned food, and all that. We are yet to see the environmental health tools that we will be using to avert the environment. Because if somebody eats, the person clothed, and the environment where the person is residing within is not safe, what next?
What are those? What are the kind of tools?
Some of these tools we think they are very key, because the place needs to be continuously every week or twice a week for 3 months, so that we can be sure that we are safe. Things like mist blowers. We need a lot of mist blowers around all these areas. We know some waste management companies are doing some disinfection around the area, but they can't reach everywhere. The environmental officers within the communities knows everywhere. They are there every time. So if all districts are distributed with at least 5 mist blowers, then insecticide spray, then snake repellent. This morning I was reading, they said at the temporary clinics, snake bite has become prevalent, and it is not let me say something that is shocking. It is bound to happen when there is flood. A lot of living organisms move with the waters. Some were living in the water, some were living on terrestrial. So when the water has come to take over their habitat, they follow the water to anywhere, and they become very aggressive because they also want to live. So when they get to a human being, they think you are the cause. So whatever they can do, they will do. So we need snake repellents as much so that we can spray the areas. When we went yesterday, we saw some agencies distributed smart toilet facilities that they are sending it around. So these people, they need education, because when there are issues like this, there are 3 key things that we need to keep in place. So first and foremost is information. What is the information around the place? What is really happening? What do the people need? What can we do? Then we plan. During the planning, we come in with all health promotion and everything. Then we come in with the education. We need infographic educational material. This is not the time for long talk education. You show them the pictures. Madam, this is this. You see this one is like this. This one is like this. Don't do this, do this. When they see it, they tend to take it better than when you talk to them without seeing it. So all health promotion agencies that have some of these infographic educational materials should please bring them out, because the post-flood management is also very, very, very key. Yeah.
Now, there have been criticisms about how this whole thing has been handled. People say there was not enough community engagement. The VRA has come with a response. There are also those who talk about waterways that have been taken over, no lack of dredging and all that. Before you respond to the issues, especially about the lack of dredging and what we know about the environmental factors that have also contributed to the stagnation of the water and its inability to flow, do you know if the environmental health officers in that region were aware of what was happening? Were there any, you've spoken about post-flood management, but were there any pre-engagement before the spillage and all that?
Sure. So, first of all, I said in terms of this, we need first-hand information. So the first-hand information, when the dam was getting full, they will spill it. I know they have environmental sustainable team within that area that goes round monthly or weekly to give information about what is happening at the dam. Yes, we are human beings. Human beings are always very slow to change. For instance, when we are in our comfortable zone, if you ask me to move, where do I move to? If there is, let me say, there were to be some houses somewhere that they have built somewhere and said, move to that place, everybody will be in a hurry to move to go and get a better place. But move to where? A camp. Now they are moving to the camp. What happened? It's a school. Maybe the toilet facilities that were found in that school is just for about 200 or 300 students. Now people more than 1,000 are going to fall on that same sanitation facility. Pressure. How are they going to use it? How are they even going to manage their waste? All these things are issues. What are the drainage, there's possible drainage systems that are going to be put in place to ensure that even when the water is being spilled, there are some drainage systems that the water will channel it through into the sea. Did we do all these things? All these things are part of the planning.
Were you aware are you aware if your colleagues in the Volta region were involved in all of this as environmental health officers?
Okay, so what I know is during the spillage, when they were forming the disaster management committee, so officers at these affected areas were part.
Okay,
yes.
So this was after the spillage started?
That is what I know.
Right.
Yes.
Okay, now let's talk about the water. There are those who have said that, look, the sea doesn't take certain volumes of water at a time. It will bring it back. We had a caller calling in. I don't know about your knowledge in that, but there are also those in our engagement over the time. There was an MP who raised concerns about the people rejecting, and this was much earlier, a dredging project. They said that their oysters were going to be affected, and so they didn't allow the lagoon to be dredged. How do all these environmental factors, buildings that are not supposed to be where they are, trees that have been cut, that may even block the flow and the intensity of the water's flow, how do all these things affect the situation?
Yeah, thank you. So, let's ask ourselves, how old is the Akosombo Dam? Which people were managing the dam? How was it managed? How were they dredging the lagoon that it used not to have an issue? And what has changed now? What fuel were they using previously? And what fuel are they using now? That might have led to destruction of the ecosystem, the marine ecosystem, that the marine lovers has to take this issue to court. Now, maybe somebody has compromised the quality of fuel that they use to dredge, and the other the new fuel that they use now has something to affect the marine life. Maybe that could be the problem. I'm not an engineer in that as mechanical engineer, so I cannot talk much. But looking at our wetlands, there used to be so many wetlands with full of mangroves that these were the area that when these waters were being spilled, the water will settle there, and then it will be releasing bit by bit naturally into the system. But now, where are they? Most of the wetlands have been encroached because man think the land is for us. We can do anything. But we forget that man cannot cheat nature. When you cheat nature and you think you are smart, nature has its own way in paying you back. And when nature hates, it's disaster. And that is what we are seeing now. Yeah.
That's a very profound statement you make there. And so moving forward, this has already happened. Unfortunately, people have lost investment, huge investment. We've been speaking to farmers. Farmlands are all gone. Those who are into fish farming, people have lost fingerlings and all that. So it's quite an unpleasant thing. But we're looking at the way forward now. And there are those who said, we must learn from this. It should not be the annual thing. Also because we know that climate change is a big issue.
Sure.
The Vice President, when he visited the area, spoke about it. Now we are having a lot of heavy rains causing flooding upstream, which is leading to the Volta Lake overflowing, which feeds the dam, and then we need to spill because when the dam breaks, that's a bigger disaster on our hands. So, considering the fact that there's climate change to deal with, there's the human factor, taking over wetlands to deal with. This should take a national dimension, shouldn't it? We should have a more holistic approach to dealing with the problem because we cannot tell if there will be another spillage next year. What are your recommendations?
Okay, thank you. Disasters are unplanned for. That is why every country needs to have what we call a contingency plan. In every planning, you need to plan for unforeseen issues, natural disasters. So, kudos to some of the affected areas. We have seen that they are building resettlement areas for them to move to. If you want to resettle somebody, what do? You must find a way. I believe in when you want to enforce a law, provide an alternative so that when people refuse to follow that alternative, then you come in with the enforcement. And that one, nobody can say that you are going a wrong way. Some of the areas are there, I don't think people should go back. Okay. It's a no area. Okay. Especially those living around the cemeteries.
Okay.
Because cemeteries are being submerged. And when cemeteries submerge, sometimes we may not know, but loose graves, water can wash even bodies out and leave empty graves. Microorganism begins to multiply in a very high speed. That is why the stench is now coming out. Even they don't even have good air to breathe. It's also another thing. So we need to look at all these things, and then we put in a very permanent planning. If they are going to have a regional, that area where, for instance, every now and then we keep receiving such things. Those living around the lake from the north through to the Bono through to the Volta and through, they can come together and then have something like a joint contingency preparedness committee, so that they will allocate some form of budget for it. Then they sit down to plan. Initially I said there are 3 things we need to do, and if these 3 things are not done well, it will jeopardize everything. First is information. You need a first-hand information of what is going to happen if it is yet. If it has happened, what has happened? What are the risk factors? We shouldn't do discretionary things. We should think about the risk factors, the cost. Now look at the number of things that are going to this area. if this didn't happen, we could have used some of these things to do another economical development somewhere. But it has happened. Nobody calls for it, and it has come. And we are really sympathizing with, we are empathizing with them because we put ourselves in their shoes. Yeah. So we don't want it to come. So we think the government should see this as a warning sign and get this joint contingency plan preparedness committee, get some form of allocated fund for them to sit down and plan of what to do, a permanent solution, so that we don't envisage such a thing coming again. Every year, Bagre Dam, we go there, we come back, we sit down, we are like the vultures. The vulture will say, after the rain, I'll build my house. After the rain, they forget to do it. So it shouldn't be. Yes.
In fact, when we spoke to some of the officials in the Pro East side, in the Bunu region, they actually told us that in one of the communities that was affected, they relocated there because the Volta Lake took over their lands. But now the lake is meeting them again. So they're actually suggesting that they should be moved to a permanent location where they don't have to return to those communities. But again, the question is at whose cost? 1. 2, just learning from that example of moving and the lake catching up with them. What is the possibility that it will not catch up with them again? What must be the learning for us? There are those who have said that there are scientific ways to go about this. You spoke about the Bagri Dam. The Palugu Dam was supposed to help in doing that, right? In catching and collecting those waters so that they don't destroy farms and property. We seem to know what to do, but we never do it. Is that not more of the case?
That is the case. And one thing too is, we are human beings. Everybody has a vocation that you depend on. We have fishermen, people who have their daily bread from the distance. During the Akosombo Dam building, to the best of my knowledge, I know they said a lot of them were compensated to move to higher heights. They were moved to higher heights. But tomorrow I need to come and fish around the riverbank. You come there, you put a shed there, you sleep. Before we realize, it becomes another settlement. And that is human being. Who enforces that it doesn't happen? Everybody has a role to play when it comes this way. This is not the time for blaming game. Because if you start blaming game, you will be hurting people the more. This is the time for looking for a solution. Let's think about how we can have big retention ponds somewhere to receive some of these waters. We are thinking about irrigation all year round. This can put people into job opportunities. There are a lot of people who want to go into farming around the northern sector. But the raining system around that is just a short period, so you can't do it. So if you are able to get big dams around where the lake is passing through, just like the Palgu Dam, it is a lake that they also had to do something. So if the Palgu Dam is able to be dredged and then worked, that's what I'm saying. If they are able to work on it, because we heard that they were working on it. So if it is true, they work on it, it will receive a huge portion of water. Irrigation pumps can be channeled to it. It can lead to, a job creation, nutritional improvement, and everything. Yes.
I have a few minutes to go, but this time round, I want you to address the people who are affected by this. I know a lot of them watch us here on Joy News. Just a few tips for them to avoid being victims of any outbreak.
Okay.
The few tips you have to share with them on how to manage themselves, manage the situation they are in so that their health is preserved.
So what I'm going to tell the affected area, the people there, will be that, 1, they should ensure that anything that they touch, even their toilet facility, how they manage it, they should minimize with more touch in the toilet facility that they are using. When you visit the toilet and you come, try to wash your hands with soap and water. We need sanitizers. Try to sanitize your hands. The children who play, they should ensure that they pay more attention to the children, because when they play and come, they need to see to it that they wash hands. During COVID, people were dying for sanitizers, but now when you even give sanitizer to somebody, they don't want. But this is the time they need to have sanitizers along with them. They should also ensure that the water that they drink, even if it is a borehole water, they should try to boil it. That is one. That is what they can do. And we also plead with benevolent societies that are donating that. They shouldn't just send only food items and water. They should also send some of these chemicals that we can use to sterilize the water for them to drink. That one is also another key thing. So we should find a hand washing stand somewhere,
right.
All areas so that we used to do during COVID, because
right.
it will also help to bring down any form of outbreak that we are anticipating.
I appreciate your time and your help so much. Florence Kuchi is Director of Public Health at the Accra Metropolitan Assembly. She's also part of the Ghana Environmental Health and Sanitation Professionals Association. And together with some of her colleagues, they visited affected areas flooded as a result of the spillage of the Akosombo Dam. Oh, you also donated?
Yes.
Thank you so much.
Yes,
God bless you for doing that.
We just didn't go. We
public
donated
about
after
that interaction
yes.
with your colleagues.
Yes.
All right. Thank you so much. Bless you. So, I mean, for those of you who are thinking to support communities affected by the flooding, not only in the Volta region, but in the Pru areas, the Savannah areas, don't just go with food, mattresses. Those are essential, but also you can take hand sanitizers along. You can take some of these chlorine tablets that our people need to sterilize water so that it's safe for them.
Filtration materials.
Right, filtration materials as well. So you can also get in touch with any health officer in your area to find out how best you can help in terms of mitigating or averting a public health crisis as a result of these floods. This is the AM show. When I come back, I will be speaking to reps from an educational institution to tell us more about that. Do stay.